Hi, I'm Kelly English, and I'm part of the Arthritis Patient Advisory Board for the Arthritis Research Canada. And I'm here today with Marie Westby, Dr. Marie Westby, who's a physical therapy teaching supervisor and a clinical assistant professor at Mary Pack Arthritis Center in Vancouver. And I'd just like you to tell us a bit about yourself and how you got into that.
Thanks, Kelly. I have been in the field for almost 29 years. So when I was finishing my physiotherapy undergraduate training at UBC in Vancouver, my very last placement was at the Arthritis Center, which was part of the Arthritis Society at the time. And I fell in love with the field of arthritis and the patients I was working with. And it was a complete switch from where I was thinking I was going to work with young kids in sort of injury prevention. And I, at that time, asked for a job and was offered a job right after doing that placement, and I've been there ever since.
Good for you. And the Arthritis Treatment Center really is pretty phenomenal.
It's a fantastic, and I think a lot of people stay there for a long time because it's a diverse population, from young kids that we have in our program to seniors, and a variety in complexity. I think I like some of the problem solving and the diversity of the conditions that I was working with. And for someone like me who likes to always be trying to figure things out, it was both a challenge and incredibly rewarding. So that's why I've stayed there that long.
Well, people don't realize that there's not just two different kinds of arthritis. Osteo and that little bit of rheumatism that your grandfather had.
Yes.
That
Yes.
there's over 175, I think they've said now. And probably more, if the truth were to be known. So it would be a diverse population you're getting. Now, you have been developing a toolkit. And can you tell us a little bit about that and how you came about to do it?
Sure. So a toolkit is just kind of a trendy word, I think, right now for a collection of resources, and often they're online toolkits. So this toolkit was around hip and knee replacement. And outcome measures. And clinically, we use outcome measures, which may be pieces of paper, like you're holding, where patients fill out a questionnaire, answer questions about how they're feeling this week, how much difficulty they're having doing day-to-day activities. So those are referred to as patient-reported outcome measures, or PROMs, often we hear them as. And then there's also what we call performance-based measures, where we may, measure someone or time them, see how fast you can walk a certain distance and calculate their walking speed.
In there.
how long you can stand on one foot, get a sense of your balance. And there's some very standardized or consistent ways that we can do that. And in total joint replacement surgery, both leading up to it, so someone maybe is on the wait list to have a replacement, goes through the very short hospital stay now, and is recovering. There's lots of opportunities to use those outcome measures to track progress, make sure people are on track as part of their recovery, and to share the results with patients to let them know how they're doing, and also with other providers, because often people will see a surgeon and one therapist before surgery, a different set of providers in the hospital for that short stay, and then a whole different group of providers or rehab professionals afterwards. And so what we were trying to advocate for was that we all use the same measures, so we can all talk the same language. So this toolkit is a collection of tools or measures and ways that we can assess people's progress, and put it all in one simple place on the website. And the workshop that I did yesterday was to show people what's on that website, how to access it, how to take that information and use it to make decisions around care and to share the results with patients. So it's not just us taking that information from you and then not using it back.
Perfect. Now, in Canada, we obviously, probably more than a lot of places, we have so many remote areas, which have limited access. Is some of this stuff like exercise or anything like that that is on the web that people can access?
There is. So this toolkit is geared towards clinicians, surgeons, anyone who could be a community nurse, anyone who's providing care. And that's the focus of this total joint arthroplasty and outcome measures, or TJOM as we're calling it. But my other work is to develop also an online toolkit around quality indicators. And those are indicators or sort of standardized evidence-based approaches to doing assessment, to prescribing exercise, to providing care both before and after surgery. And those will have resources and tools specifically for patients, and ideally for people that are living in more rural areas where we know they don't have as much access to rehabilitation or to exercise. In some cases, their exercise advice and support is done through telephone or tele-rehab or over the internet. Or we're doing focus groups right now to see what people want, and we'll be doing a survey across Canada, which we'll be looking forward to working with this organization to disseminate, to find out what people want, because there's still a large group of older patients and younger who like paper and want to monitor their care and see what exercises they should be doing on paper, and others who are happy to go onto the internet and look at videos and that.
So the videos and papers that will be in this toolkit, have they been vetted to make sure that they're what physiotherapists think are easy to read, or?
Yeah, so similar, which a process that you're very familiar with, yet another repository of online resources around physical activity. So there are some nice tools that we could all be using when we're developing online educational materials for patients or the public that allow us to evaluate the content and the applicability and the accessibility of some of these tools. Are they written in a language and prepared in a format that can be easily applied and understood? Do they make good use of visual cues and summarizing and key bullet points? So it's easy to take out sort of the key messages from some of those tools. So as we develop the resources for patients in this quality indicator toolkit, we will be looking and following that guideline as we develop it, and then we'll be doing some testing with it as well to make sure it is accessible, patients do understand it. That's what they were looking for when they told us they wanted that.
So these two toolbox kits, that feeds quite into the Canadian Rheumatology Association's theme for this weekend, which was sustainability. Mm-hmm. Then it should help give a little bit of power to the patient,
yes,
to be able to do a little bit, and also to the clinicians, mm-hmm, to know exactly what they're doing then.
And we've called the toolkit that I'm developing, that is part of my research, is called EQUIP, TJA. So it's equipping patients with the tools, resources, knowledge at their fingertips to be able to make choices around their health care. In some provinces, after you've had a hip or knee replacement, you actually have a choice of rehab providers or physiotherapists to go to. And so I'm encouraging them to know what sort of the minimum standard of care is, so they can make choices around where they can access that, how they can communicate with that physiotherapist to go, will you be able to provide me with A, B, and C, because I understand that's what I should expect, or that's what I should look for in my care. So that's why we use the acronym EQUIP, so that it would reflect that.
I think this is wonderful. I think this is wonderful to have a standardized care, to be able to see outcome measures, that everybody's doing sort of on that same page. And I like the sustainability. We know that we need that. Our health is demanding it. Yeah. So if you were to be able to see sort of 5 years into the future, for example, in arthritis, is there any changes you'd like to see?
I think I would like to see more of that concept. Not only, I'd like to see the concept of patient-centeredness truly realized, but I really like I'm hoping with all the technology and resources that are evolving quickly as we're learning them in this session.
Amazing.
Is around patient choice. And so those patients that do want to take advantage of technology and accessing their own information and being the driver of their care have those options and tools available to them. But that there's also choices for a more traditional approach where they want to access more traditional care, face-to-face care, one-to-one, and so that we're matching the types of things that we offer in each of our provinces to really what patients want. And it's the choices. I'd love to see everything from someone who's doing really well, say after their diagnosis or their surgery, and they just like to check in every couple of weeks, and maybe through the internet or an app. And in people in more remote or rural areas, that would be tremendously beneficial, versus those that maybe have more complex needs, aren't quite sure what to do, and feel they need more of that one-on-one or in-person care, and then the whole continuum in between. So I'd love to see technology be used more and more to reflect that so that patients can really choose the level of care that
We
they'd
have
like to have.
definitely seen that here. There's been some really neat
Some sessions,
workshops
yeah.
on things. Thank you. Have we got any questions from the audience today?
Yeah, so someone wants to know how all these toolkits you're talking about will be made available to patients down the road.
That's great, and that's actually one of the questions we're asking patients who are participating in our focus groups right now, and we'll be asking on the survey, is once this toolkit is available, and it'll have some paper products as available as well as some online products, how do you want to hear about it? And we're getting some really interesting suggestions, everything from national television to CBC Radio 1, to local newspapers, to this organization and other patient advocacy groups, to wanting to see what they call like a rack card in surgeons and rheumatologists and doctors' offices so they can pull it out and
It's
see
really
information.
interesting
Yeah,
ideas.
so I'm really asking both the clinicians who are part of this survey as well as patients to say, how would you like to know about this once it's available? So we're getting some very creative ideas, and we will then sort of direct our energy and resources towards those most popular ones.
I think it's wonderful. Thank you,
Great,
Dr.
thank
Westby,
you.
for talking to us.
You're welcome.
Were there any more, Anita? Before I-
No,
No.
we're good for now.
Continue to put in your questions if you need to on the web. We will redirect if we need to and answer those questions. And good luck.
Thank you very much.
you.